All right, so today we're really diving into a global health challenge, and one with some pretty staggering numbers, actually, diabetes. I was looking over those sources you sent, one from the World Health Organization, the other from the Cleveland Clinic, and wow, that WHO report, really eye-opening. For example, did you know that since 1980, the number of people dealing with diabetes it's jumped, like skyrocketed, really, from 108 million to 422 million around the world?
It's a massive number, hard to even wrap your head around. I mean, that's like, think about the entire population of the European Union all living with this one condition. And what's even more concerning, I think, is how fast it's increasing, particularly in low and middle income countries. Makes you think about, healthcare access, resources, that whole picture.
Exactly. It really highlights the global scale of this whole issue.
Yeah.
So before we get too far into those bigger trends, let's make sure we're all on the same page, starting with the basics. What actually is diabetes? The Cleveland Clinic source breaks it down pretty well, talking about how our bodies use glucose for energy and insulin's role in that whole process.
Right. It's like this. Insulin is the key. It lets glucose get into our cells to be used as, well, energy, fuel. But when your body doesn't make enough insulin, or if your cells get resistant to it, that's when diabetes can develop. And of course, this can happen in a few different ways, which is why we have different types of diabetes.
And knowing the type matters, right?
Yeah.
Because it's not one size fits all when it comes to this.
Exactly. Both sources really hone in on the most common ones, type 1, type 2, and gestational diabetes. And each one is, well, it's a different dysfunction in how the body handles insulin. And that difference changes everything, from treatment to how you manage it long term.
So a type 1 is like the body's attacking itself.
Right.
An autoimmune thing where it goes after those insulin-producing cells in the pancreas.
Big difference there with type 2, where the body either can't make enough insulin or the cells are just like ignoring it, becoming resistant, often linked to lifestyle, but genes play a role too. And then you've got gestational diabetes, which, as the name suggests, pops up during pregnancy and usually resolves afterward, thankfully.
It's kind of wild how much variation there is within just one condition. Makes you realize saying I have diabetes, it doesn't give the full story at all.
Not even close. And that's why understanding the type is so important. It lets you be more targeted, with your treatment plan, lifestyle changes, all of that. Gives you a greater sense of, I don't know, control over the whole thing.
Empowerment, right. It's about giving people the information so they can make informed choices. Now, I want to go back to that global increase we were talking about before. The WHO report, it paints a pretty alarming picture, to be honest. Between 2000 and 2019, there was a 3% increase globally in death rates due to diabetes. But here's the thing. In lower middle income countries, that number is a whopping 13%. And I mean, it's not like every case has these severe consequences, but it shows you how serious this can get, right?
It's true. When diabetes isn't well managed, it can have this domino effect on your body. We're talking about heart disease, stroke, kidney damage, even vision loss. And in places where healthcare is harder to access, those risks, they become even more significant.
Right. So it's not just about having diabetes. It's about managing it well so you can hopefully avoid those other issues down the road. And since we know type 2 is driving a lot of this global increase, what makes someone more likely to get it in the first place? The Cleveland Clinic outlines those risk factors really well, and a lot of them, well, they're connected to lifestyle choices.
Totally. We're talking weight management, how active you are, what you're eating, it all matters. I mean, we always hear about the link between type 2 diabetes and obesity. And while it's not a simple cause and effect thing, it's clear that maintaining a healthy weight through diet and exercise can really, really reduce your risk.
So it's not just about genetics or family history. Those things are definitely part of the puzzle.
Yeah.
What we do every day, it really can influence our risk.
100%. And that's where I find both of these sources to be pretty empowering, actually.
Yeah.
Yes, medication is often necessary, but they both stress how important prevention is and how much power we have through our lifestyles.
It's about taking charge rather than just reacting once something goes wrong. And speaking of taking charge, both sources actually give some really concrete recommendations, which is great. It's not just the usual eat healthy, exercise more.
Right. I love how the WHO breaks it down. It's clear. Maintaining a healthy weight, getting at least 30 minutes of moderate intensity exercise daily, that could even be a brisk walk. It all adds up. And of course, eating a balanced, nutritious diet. Simple, but important.
Oh, and I like how the Cleveland Clinic really gets into dietary changes, like cutting back on sugary drinks, those sneaky culprits, choosing whole grains over refined ones to keep blood sugar levels in check, and filling up on fruits, veggies, lean proteins. It's about those sustainable swaps, not crazy restrictive diets.
And what's so encouraging is that even small changes, if you keep at them, can make a big difference over time. It's about building those habits that become second nature, not overwhelming yourself with a total overhaul.
Small steps consistently lead to big changes. That's the idea. Now, we're focusing on prevention and management, but we do have to acknowledge that diabetes can have serious consequences. The Cleveland Clinic lists out those potential complications, and, well, some of them are pretty scary, to be honest.
Yeah, no sugarcoating it. Uncontrolled diabetes can impact, well, pretty much everything. Your heart, blood vessels, nerves, kidneys, eyes. It really underscores why taking this condition seriously is so important. And it's not just the physical stuff. The Cleveland Clinic source, they mentioned the mental health aspect too, how diabetes can increase the risk of depression. It's a good reminder that this is about the whole person, physical and emotional well-being.
Absolutely. Can't forget about that mind-body connection.
Yeah.
But on the physical side, with those complications, is there anything giving you hope? Any new treatments or ways of managing diabetes that are looking promising, maybe helping reduce those risks?
Oh, for sure. I mean, yeah, we got to be real about the challenges, but there's a lot of exciting stuff happening. Like the medications being developed now, some of them, they're not just about blood sugar control anymore. They're also targeting things like high blood pressure, cholesterol.
Wow.
Those things that up your risk of heart problems.
So it's like a multi-pronged approach,
Hmm.
tackling those different layers of risk. What about insulin delivery? I know there have been some big changes there.
Huge. Insulin pumps, those are a game changer for a lot of people. Instead of multiple injections every day, it's continuous personalized dosing. More flexibility and more control really makes a difference.
Speaking of technology, I have to ask about those continuous glucose monitors. Everyone's talking about them. For someone who might not know, what are they exactly, and why are they such a big deal?
They're pretty amazing, honestly. So with the CGM, there's this tiny sensor that goes right under your skin, and it's constantly measuring your glucose day and night. Sends those readings to a receiver, could be a separate device, or even your phone. No more constant finger pricking.
That sounds way less disruptive. And I imagine having all that data, it helps you and your doctor make better decisions, right?
Totally. It's like having a high-def view into how your glucose is behaving. You catch those highs and lows early, see patterns, and then you can be more proactive. Like if you notice your blood sugar always spikes after eating a certain thing, well, maybe you and your doctor or a dietitian tweak your diet a bit.
It's about making those informed choices, using your own data. That's powerful.
Exactly. And both sources really stress this: work with your doctor, don't go rogue and make big changes on your own based on the data. It's about having more informed conversations with your care team.
Becoming a true partner in your own healthcare. Now, the WHO report, it mentioned the economic side of diabetes, which adds another layer of complexity here.
Right. I mean, these sources don't get into the nitty-gritty of the numbers, but the economic burden is huge. Think healthcare costs, but also lost productivity, people dying younger than they should. It's a lot.
So we need solutions that aren't just about individual health, but about the impact on society as a whole.
100%. It's about shifting our mindset, focusing more on prevention, being proactive, and taking a more holistic view of care.
Makes sense. Okay, we've talked about the types of diabetes, risk factors, complications, some of the promising advances. But I think it's easy to get caught up in all that and forget about the daily reality of living with this condition. Both sources emphasize blood sugar monitoring. But why is it so important? It's one thing to know you should do it, another to really get why it matters.
You're right. It's easy to see it as just another thing on your to-do list, but it's really a feedback system, It shows you how your body responds to everything: food, exercise, meds, even stress.
So it's not just checking it randomly, it's about noticing those patterns, making adjustments based on what you see.
Exactly that. The more regularly you monitor, the better you understand your own personal glucose patterns. Like if you always have a dip after working out, you know to adjust your snack beforehand.
And with those advancements we talked about, those CGMs, it's gotten a lot easier to keep track, right? Hopefully that means people are more likely to stick with it and ultimately be healthier.
Oh, definitely. CGMs have been a game changer. That real-time data, those alerts when something's off, it gives people so much more control in a way that doesn't feel overwhelming,
It's about feeling empowered, not like the condition is controlling you.
Exactly. And on that note, it's important to remember you're not alone in this. Both sources talk about support systems, how crucial they are.
Having family, friends, maybe a support group,
Hmm.
people who get it, that can make a world of difference.
For sure. Just knowing you're not alone, having that support network, it's huge.
It really is. Having that community, those people you can lean on. So before we wrap things up here, I'm curious, from your experience, what's, I don't know, maybe the biggest myth or misconception people have about diabetes? What do you hear a lot that's just not true?
Good question. I think a lot of people, they hear diabetes and they think, okay, that's it. No more enjoying food. Like it's all restriction, deprivation. But that's really not the case at all.
It's about making different choices, not necessarily saying goodbye to everything you love.
Exactly. There are so many delicious foods out there that fit perfectly well into a diabetes-friendly diet. It's more about shifting your focus. Instead of dwelling on what you can't have, explore all the amazing things you can have. Get creative in the kitchen.
Well, finding that balance, right? Where you're eating well but still really enjoying it. And with the right support, the right information, it seems like you can really thrive, not just manage.
Absolutely. And that's what I hope people take away from this. A sense of hope, of possibility. Diabetes is serious, yes, but it doesn't have to define you. Not at all.
It's about being informed, being your own advocate, working with your healthcare team, and being open to learning as you go.
Well, we've covered a lot of ground in this deep dive. Types of diabetes, those risk factors, new treatments, the whole lifestyle piece. But like you said, it's a starting point, yeah. There's always more to learn.
Always. The research is ongoing, new discoveries all the time, which is exciting.
Yeah, it really is. So for our listeners who are ready to go even deeper, where would you point them? Any resources or organizations that you find particularly helpful? Definitely. Online, there are some great organizations. The American Diabetes Association, Diabetes UK, the International Diabetes Federation, they're all fantastic. Evidence-based info, support groups, they can even connect you with specialists.
So tapping into those networks, finding that support, because you're not alone in this, not by a long shot.
Exactly. And never underestimate the power of knowledge. The more you know about diabetes, the more equipped you are to manage it, to live well.
It's about taking ownership, embracing the journey. Well said. We hope this deep dive has given everyone some valuable insights and that sense of, a little bit of hope, some motivation to move forward. Thanks for listening, everyone.